Let's talk about some pelvic health myths that way too many people still believe. Whether you've had a baby, you've gone through menopause, or you're just trying to better understand your body, you deserve real information without the shame or the outdated advice. I'm Dr. Alex Hill. I'm a double board certified pelvic health and oncology physical therapist, and today we're busting 5 common pelvic health myths that might be holding you back. So stick around because chances are you've heard of or believed at least one of these myths. Let's start with one of the more common myths out there. Many people think that if you've had children or you're getting older, that bladder leakage or incontinence is just your new normal. But that's not true. Leaking pee, whether it's a little when you sneeze or a lot if you can't make it to the bathroom in time, is common, but it's not inevitable, and it's definitely not something that you should just have to put up with. These symptoms can be a sign of pelvic floor dysfunction. These are your pelvic floor muscles here, and this can often be treated successfully with pelvic health physical therapy, behavioral changes, bladder retraining, or other strategies to help you stop leaking. You deserve to live your life without having to scout out bathrooms everywhere you go or carry a bunch of pads with you. So get help for the leakage if you have it. Kegels are often handed out as a one-size-fits-all solution to any pelvic health concern. Leaks, pain, prolapse, you name it. And if you're not familiar with Kegels, these are repeated contractions of your pelvic floor muscles. So you're contracting and relaxing, should feel like almost like you're trying to stop urinating. So that's a Kegel, but these are not a one-size-fits-all and they shouldn't be given to everybody. So if your pelvic floor muscles are already tight, overactive, they're not coordinated, then doing Kegels or repeated contractions can potentially make things worse. Think of it like trying to strengthen a muscle that's already clenched. Your muscles, regardless of where they're at in the body, need to be able to be flexible, mobile, and strong to do the job. So what you need is not doing Kegels to the beat of a song online, and it's really an individualized approach, usually guided by a pelvic health physical therapist to know if strengthening, lengthening, or coordination work, or all of the above, is really what you need for your problems. All right, this next myth is about menopause. So menopause is often reduced to just 2 things: your period stopping and dealing with those hot flashes. But really the truth is menopause is about so much more than that, including pelvic health. For many people, that also means changes to their bladder and sexual health, and this can be uncomfortable and really affect your quality of life. But these issues don't have to be accepted as just part of getting older and going through menopause. Pelvic health physical therapy can be an absolute game changer, helping to retrain, you guessed it, your pelvic floor and your bladder if you have urinary urgency or leakage, incorporating vaginal moisturizers and lubricants for comfort, and really optimizing your vaginal and bladder tissue health. Now, yes, menopause does signal a huge shift in your body, but that doesn't mean giving up on feeling your best and dealing with all of those symptoms that come along with menopause. The next myth is that pain with pelvic exams, menstrual products, or intimacy is normal. Pain with doing these activities is never something that you just have to accept and deal with. These experiences might be common, but that doesn't mean that there isn't treatment available. Pain with these activities can be linked to pelvic floor tension, hormonal changes, scar tissue, stress, trauma, or other medical conditions. If you feel dismissed or you're just told to relax with the pelvic exams or have a glass of wine before intimacy, it's okay to seek a second opinion and to find someone that listens to your experience. Pelvic floor physical therapy, trauma-informed providers, and even small changes in how exams are done can make a huge difference. So again, you don't have to live with and deal with and grit through these penetrative activities like pelvic exams, inserting tampons or menstrual cups, or intimacy. Myth number 5 is that pelvic organ prolapse means surgery is inevitable. So we gotta talk about prolapse, and this is when pelvic organs start to shift or drop down into the vaginal space. That means your bladder, your uterus, or the rectum can all start to drop down, or just one of them can drop down. Signs and symptoms of prolapse symptoms could be pelvic heaviness, feeling like something's falling out. You could have some dull ache or pressure in your abdomen or your low back, or you could actually see or feel something when you wipe or go to the bathroom or even in the shower. Many people are told that surgery is the only answer for prolapse, and that can be kind of scary, but in reality, there are a lot of conservative ways to manage prolapse symptoms, especially if they're mild or moderate. Pelvic floor physical therapy, posture, pressure management, and tools like supportive garments and vaginal pessaries, so this is something that can be inserted into the vagina to help support the organs, can all be really helpful for managing your symptoms. Now, if you have a very severe prolapse or you're very symptomatic, yes, surgery is absolutely an option, but don't automatically assume that that is what you have to do, and you can't try some of these more conservative options. Every body is different, and so is every prolapse, so just talk with your provider about what might work best for you. So, have you heard of these myths? Did they make you pause or think? If they did, that's a good thing. You deserve accurate and empowering pelvic health information and support that meets you where you are. If you like this video, please don't forget to like it, subscribe to my channel for more pelvic health videos, and share with someone who needs to hear about their pelvic health.